Good afternoon, everyone. I am Ada on behalf of IGCP. I warmly welcome to all our respected doctors and participants for today's academic session. Today's topic addresses a critical and sensitive area of maternal health care: STIs in pregnancy, protecting two lives at once. Sexually transmitted infections during pregnancy pose significant risks, not only to the mother but also to the unborn child, from vertical transmission and preterm birth to long term neonatal complications. To save around both lives. This session aims to enhance our understanding of screening protocols, treatment strategies, and preventive approaches in maternal care. It is my privilege to introduce our speaker for today, Dr. Uday Kumar Jadhav, sir. He did MBBS, CHIV, PDCR, AFIH, infectious diseases consultant in charge ART Center and LNT MDACS in Mumbai. He is the owner of Life Care Clinical Total Care in HIV AIDS in Aurangabad, Maharashtra. He attached to Panacea Super Speciality Hospital in Aurangabad. He is consultant at Shraddha Hospital and Critical Care. Dr. Jadhav brings extensive experience in infectious diseases like HIV management, STI care. His clinical expertise in preventive vertical transmission and managing infections in vulnerable populations make him ideally suited to address this crucial, crucial topic. With great pleasure, I now invite Dr. Uday Kumar sir to share his insights. Sir, this is over to you. You can proceed with the next. Thank you.
Thank you very much, Ada. So today we are dealing with a topic called STIs in pregnancy, protecting two lives at once. So pregnancy is a crucial time in a person when she has double or dual responsibility, the responsibility of the child as well as the health herself. And so is the doctor who is overwhelmed with this double responsibility. The doctor has also focus on the maternal as well as the fetal health. So this becomes a ulterior challenge. So what are STDs? STDs are infections, sexually transmitted infections which affect millions of people worldwide. And as we know, pregnancy increases the vulnerability to complications. Previously, women were having a hard body structure. They were working in the fields, they were strong. But right now, with the impact of the modern living conditions, the pregnancy has become more vulnerable and it leads to a lot of complications. There is the impact of this adverse situation on the mother as well as the fetus. The mother is affected, and also the child, which is still unborn, has lot of issues to face. So these two things can be managed with early detection and saving the two lives. We are planning lot of ways to decrease the maternal mortality as well as the infant mortality rate. This can be achieved only with early detection. So, how much is this spread? There is a high prevalence in the reproductive age women regarding the infections. It is common in low resource settings and often asymptomatic. It is a major public health concern. Since we have started ANC management and collaborated it to a hospital delivery, lot of infections can be treated early. But still, the workload as well as the way in which the people should be aware of these things is still critical. Lot of people do not understand the importance of these infections and fail to work it on. So I would suggest we should be very much reduced. So what are the changes that happens in pregnancy? Number one, there is a physiological change. What kind of physiological change that we see? Number one, we see there is a altered immunity. That is, there is a relative immunosuppression. The body of the woman has to work more. She has to cater the needs of her own body as well as the child, and therefore she is more prone to infections. Also, there are a lot of hormonal changes which affect the vaginal flora. This happens to tend to change to or shift towards more infective side. Also, there is an increased vascularity of the genital tract leading to spread of the infection. Also, there is high risk of transmission to the fetus. Lot of diseases that were not there priorly are still coming up due to these kind of physiological changes in the pregnancy. What are the major modes of transmission to fetus? Number one is transplacental, that is, transferring of the infection via placenta from the mother to the child. Example is syphilis. Syphilis, as we know, is transmitted by Treponema pallidum. It is a spirochete, a kind of bacteria that can infect. Syphilis was one of the highest infection previously 100 years ago before the advent of penicillin. After the advent of penicillin, they decreased. But right now, again, we are seeing more syphilis infection. Then there is ascending infection, that is chlamydia, in which the infection ascends from the genital tract to the baby. There can also be infections during the delivery, like gonorrhea or herpes simplex virus. Postpartum, we can have HIV via breastfeeding because lot of national programs say that HIV doesn't spread through breastfeeding in the norms and ask their mother to feed. There is lot of ambiguity in this particular method, and I feel that is one of the chance in which a person can get HIV. So, what are the common STIs in pregnancy? The number one, as we know, is HIV. Number two, we have syphilis, which is growing right now. Syphilis was not seen in the previous 10 or 20 years, but right now, syphilis has become rampant. The reason for increasing syphilis are seen that we have stopped penicillin, we have stopped having sexual protection. These are also increasing syphilis. There is also gonorrhea, then chlamydia, herpes simplex virus, also known as HSV, and hepatitis B. What about HIV in pregnancy? The risk of mother to child transmission in HIV is low, but without treatment, it is up to 15 and also go to 45% transmission risk. We know that the ART that we receive nowadays is very much potent. This potent infection can reduce the risk less than 5%. But importance of early screening and ART is prudent. Lot of people who are having HIV do not want to tell the status to the surroundings or to the people who are taking care in the ANC care. When they keep this there are a lot of chances that they miss of ART. Sometimes, or in majority part of our Indian subcontinent, the woman, there's the ANC treatment in one part of the country or in the in her husband's side, and for delivery she goes to her mother on mother's side. So a lot of time they do not have some papers to the issues, and therefore lot of people who are HIV positive do not take the medicines properly. There's a lot of chance they can have increase in HIV in pregnancy. Syphilis is the second most common infection in pregnancy. It is caused by Treponema pallidum. It can cause miscarriage or stillbirth. Lot of time, patients with ANC with miscarriage are not tested for syphilis. Even syphilis can lead to congenital syphilis. And what is the treatment of choice? As I told before, penicillin is the treatment of choice. But Prior to this, lot of time penicillin was not available. But right now, with the advent of new companies, penicillin drug is still again there. As you know, this should be taken under the medical supervision, as because penicillin can have allergies. Next, we have gonorrhea and chlamydia. Often they are asymptomatic, so people don't test. But in the risk of preterm labor, there are neonatal conjunctivitis. Screening in early pregnancy is always recommended. So whenever we have neonatal conjunctivitis, or if a person may have multiple sexual contact, gonorrhea and chlamydia should be suspected. Then comes herpes simplex virus, HSV or HSV2, which is a primary infection. It's very dangerous. It can affect the fetus as well as the mother. It can cause neonatal herpes, which can be a fatal infection. If there is cesarean delivery, it should be done if we have active lesions, and we should give antiviral prophylaxis in late pregnancies. There is also this hidden disorder called hepatitis B, is very common in pregnancy. This leads to chronic infection in the newborn. There is vertical transmission during birth, and hepatitis vaccine plus immunoglobulin should be given for after birth. Screen all the pregnant women for hepatitis B. That is something we have to do. A lot of people don't screen, and they may have some kind of infection in the field. What are the complications that can happen in mother? Number one, there can be PID or pelvic inflammatory diseases. There can also be infertility, which is a future risk. There can be preterm labor and also increased HIV acquisition risk. As you know, more people with infections or STIs are prone for HIV risk. Therefore, we should be very much subtle in finding out what kind of infection the mother has prior to pregnancy so that she would not affect her baby as well. What are the complications in the fetus or the newborn? Number one, congenital anomalies. No woman would want her child to have anomalies, but due to STIs, more commonly, we can see congenital anomalies. Secondly, there can be LBW or low birth weight babies. Stillbirth is still a common infection part we can see. There can be neonatal sepsis and also developmental delay. So, to avoid this, we need to focus on how we can test and treat the mother as well as the baby in the near future. What are the screening recommendation? Number one, first antenatal visit screening should be done. This ANC visit should be done thoroughly. There should be repeat testing in high risk women. HIV, syphilis, hepatitis B, they should be done mandatory. And there should be risk based screening for others. It is really important that you talk with the ANC or healthcare person to understand your health needs. Most of the women do not do that, thus leading to more of infections. What are the management principles? Number one, foremost is early diagnosis. Diagnose the patient as soon as possible. Give safe antibiotics or antivirals in pregnancy. There should also be partner treatment. Most of the time, we forget this, and this can lead to reinfection. Also, more important is counseling and follow up. A lot of the people think that even having a STI can lead to more of infections, and they should avoid the pregnancy. But that's not true. If you provide a proper treatment, definitely we can stare down the infection. We can have more of a good treatment. What are the prevention strategies that we have? Number one, safe sexual practices. Use of condom, use of having a healthy partner. Secondly, vaccination. We can have a hepatitis B vaccination. Thirdly, we can have health education, understand it. And right now, internet has a lot of ways in which we can understand a problem in your local language also. And the care, antenatal care access. which is very much prominent in all the Indian continent. Now, what is the role of healthcare provider? The healthcare provider has a pivotal role in treating or understanding the STIs. Number one, we have to do a routine screening in which we found out any kind of abnormalities in the person. Secondly, we should also have patient education. Most of the women in India, if uneducated or if unknown, knowingly have some kind of infection, they say it is normal and that kind of infection can be there. So patient education can be one of the foremost part in understanding the situation. Thirdly, there should be confidential counseling. The people should be counseled and their identity should be kept away. Also, there should be a prevented stigma. When person has some kind of infection, we have to teach them how they can prevent that particular infection and so the stigma around it. Lot of people die or they they do not put it down to the relatives and die with the stigma. So we have to take care of the health education. What is the public health perspective? Number one, integration into the maternal health program is of prime importance. There should be government screening initiatives for working on that. Reducing neonatal mortality is of prime importance, and community awareness programs which can also lead to that. We had a bigger howl when we had HIV, but when now we're facing syphilis, gonorrhea, chlamydia, I think this kind of infection is very much ignored by the government institution. So we should understand this is going to spread. This is the pre-phase. I think in next 10 years, syphilis could be more common as it was prior 30 to 70 years back. So we have a case scenario here. There is a 28-year-old primary gravida at 12 weeks. She is positive for VDRL test. Can you tell me what can be the management plan and is the partner testing importance? So I would just answer this that whenever a person is VDRL positive, we have to look for giving the person with full dose of benzathine penicillin. This dose is adjusted as per the weight with 1.2 million units per vial we can do as per the weight. And yes, partner testing is very important because if you do not test the partner, then there can be reinfection. So STIs in pregnancy can threaten two lives, the mother as well as the fetus. Early detection is the key, and timely treatment prevents complications. We should have comprehensive antenatal care, and which is the essential part of treating these particular infections. Thank you very much for this particular topic. I think this leaves with some questions with you. If you have, you can call me.
Thank you so much for this wonderful session, sir. As I can see, sir, we received few questions from audience, sir. So the first question we received, sir, what are the most common STIs encountered during pregnancy, sir, and which pose the highest risk of vertical transmission, sir?
Okay, the most common infection right now, what we face in clinic, is the syphilis, which we see in a lot of it. And the highest vertical infection is hepatitis B. Hepatitis B is an infection that lot of people ignore. Hepatitis B can spread via needle sharing, via tattooing, or piercing. And hence, I would suggest that we should have hepatitis B testing mandatory from the age of 18 years every year. If we test frequently, we can diagnose and treat. And we should also have safe partners, or we should have sexual relationship in a safe pattern so that the infection is that minimal.
Okay. Thank you so much, sir, for this answer, sir. I hope it will be helpful. So the next question is, sir, should universal STI screening be recommended in all pregnancies, sir, or should it be risk-based, sir?
Okay, so I think we had universal STI uh, screening is a better option. But again, what comes in that is a cost. A lot of people think it is higher cost of screening the thing. But in my personal opinion, I think screening for STI should be made universal, as more we screen, more we diagnose, more we treat. And if you follow this principle, then definitely the infection would be on the lower side. The society will be not having more kind of infection, and we will save both the mother who is pregnant as well as the fetus.
Okay. Okay. Thank you so much, sir, for this answer, sir. So the next question is, sir, how can timely ART and appropriate treatment reduce mother to child transmission of HIV and other infections, sir?
Yeah. For mother who is HIV positive, if she started on ART, definitely the fetus or the unborn child would be free from HIV. Now, with the advent of higher ART or highly active antiretroviral therapy, with the latest version, the child and the mother are safe during the protocol of ART drugs. These ART have minimal side effects and also did not have any kind of congenital anomalies in the child. This ART treatment, when taken successfully, deliver a better result with the child not having HIV. I suggest or recommend that any child after delivery with HIV positive status should not be breastfed because breastfeeding may lead to infections.
Oh,
Other STIs that we see during the during the fetus during the pregnancy should also be monitored. We should see how we can see how we can diagnose them at the earliest possible and treat them as well.
okay. Okay, thank you so much for this answer, sir. I hope you did justice with the question. So the next question is, sir, what are the challenges clinicians face in counseling pregnant women, sir, about STI testing and partner management?
Yeah. So whenever a woman is found found positive for any kind of STI, then the family members of that woman have a stigma. They feel that this kind of infection is in the mother or in the woman by herself. They do not take the responsibility that this kind of infection is sexually transmitted by her husband, or the husband should be also be tested. I think it is a sad thing that the couple or the married woman do not have that ability to understand the status of their infection and the relationship, and they need to understand this. So while counseling, it is a blame game. While counseling, it is the woman who is more at risk, and then she is judged. I think we should have a non-judgmental way of understanding things. Patient education is must. We should have more channels which would focus on science and the major infections that are common in this part, so that we can prevent the infant mortality, we can prevent the mother maternal mortality. We should understand with open case. Even I think before marriage or during marriage, when there is the couple should be counseled for all kind of infections or status that can happen during the courtship, so that these particular infections can be controlled. Screening them before the taking decision for pregnancy would help them to have a better childbirth, and also the child can have a better health in the future.
Okay. Okay. Thank you so much for the answer, sir. So the next question is, sir, how can primary care physicians strengthen the early detection and prevention strategies in antenatal settings, sir?
The primary care physician should first learn regarding the new infection that are there. They should get updated what kind of infections are common in any geographical area and how they can be treated.
Mm,
The If they understand the new situation, then we can diagnose them well. If we can diagnose them well, then we can
mm,
treat them well. When we diagnose the infection, if you know that we suspect some of the persons can have infections in that, Thirdly, the patient should be educated regarding what kind of infections are common and how these infections have a risk for the fetus. This how they can affect and imbibe in them congenital anomalies is something they have to suffer their whole life. I think the decision for a child should be a calculated decision. There should be a way in which the primary care physician should understand the couple, their demands, their lifestyle, and how they would raise the child. I think this thing should be considered first before having a child. Previously, it was the mother-in-law who would always be on a pressure that when you got married, it is mandatory to have a child in the first year of the marriage. I think that should be worked up with the mother-in-law as well as the father of the child, so that we can understand their mental status, we can understand their social status, their educational status, as well as their monetary or financial status, so that they can understand and learn how they should be prepared for the childbirth.
Hello, sir. Yeah. Thank you so much for the answer, sir. I hope you did justice with all the answers, sir. And thank you for such an insightful and impactful session, sir. Your practical guidance on early screening, timely intervention, and preventive care reinforces the responsibility we carry in protecting not just one, sir, but two lives at once. So, on behalf of IGCP, sir, I sincerely thanks to all our participants for joining us and contributing to this important academic sessions. Let us continue working towards after pregnancy and healthier future, sir. With all your permission, so shall I conclude this session, sir?
Yeah, thank you very much, Ada. Thank you
Okay.
very much.
Sir, any last message you want to say for our audience, sir?
The last message, okay, I would conclude by saying that we should educate the parents of the newly born, or the parents who want to have a child, so that they could take in consideration all kind of elements that can happen during the childbirth and be ready to face whatever happens in the future.
Okay. Thank you, everyone. Have a safe and meaningful evening ahead. Thank you.